McLemore, and I will be presenting about tetanus, also known as lockjaw. So today I'm going to be talking about what tetanus is, the history of tetanus, some symptoms, causes, effects, treatments, and future research. So tetanus is a bacterial disease caused by Clostridium tetani that attacks the nervous system when it enters your body, and it's also known as lockjaw. Here's a picture of the bacteria, shape. And once it gets into your body, it attacks your nervous system and disables some of your functions that you would normally be able to do. Okay. It was discovered by Arthur Nicollier in 1884. He was doing an experiment on frogs because he noticed that frogs in the specific area which had a lot of soil suffered from like muscle spasms. They weren't able to control their muscles. So he tested their blood and saliva, and he realized that they contained the bacteria. And he injected it into another frog, which was normal, and he noticed that they suffered from some of the same symptoms. Okay, so some of the main symptoms that developed are muscle stiffness and spasms, breathing difficulties, fever, rapid heart rate, and an increase in blood pressure. And in children, there's also muscle stiffness, trouble swallowing, and in severe cases, seizures. And sometimes tetanus, the patient can go up to 2 to 3 weeks without having any symptoms, and so that's why it's a very dangerous disease. And the muscle stiffness mainly affects the face first. It affects the jaw, that's why it's called lockjaw. You're unable to open your mouth like more than an inch of it. Some causes. So once you get a deep wound and you're exposed to the bacteria, which lives in dust, soil, saliva, or manure, and it enters your body, it can go into your nervous system and attack your nerves. And can get bitten by an animal, and if the bacteria is in the saliva, it can enter your body that way. If it's a deep enough bite, but if it's just a small nip, then you're fine. Here's a picture of a wound that's affected by bacteria. So the effect, like I said before, it mainly affects your muscles, and it causes severe spasms. And this is a picture of a baby who suffered from tetanus, like back in the 1800s and 1900s. The muscle spasms would increase as the tetanus got worse, and it would cause an arch in your back. So your back would slowly, as you go for prolonged periods of time without getting help from a doctor, their back would slowly start to arch backwards because of the muscle spasms, and once the spasm stops, their muscles are basically frozen that way. There's no known cure for tetanus, but there are vaccines, and once you get the vaccine, it provides an immunity against lockjaw or tetanus. It allows your body to produce antibodies which attack the bacteria, and it's usually given to infants along with vaccines for whooping cough and diphtheria, because tetanus can sometimes escalate into whooping cough or diphtheria. So for future research, they're not doing much research on tetanus because there is a vaccine for it, but they're encouraging families with small children to immunize their children so they don't suffer from tetanus. I will now open for any questions, comments, or constructive criticism.
So, who does tetanus mainly affect, like children or
Children, it mainly affects children because their immune systems are so weak. And mostly people in third world countries because they're not as modernized and sanitary. Mr. Robinson?
In your research, did you come across the rusty nail theory?
No, I did not. Stop.
What is the tetanus vaccine called? I know you got a picture of it, but I don't know what that actually is. You guys don't have any questions to ask? I will ask another question.
Jeremy?
Do you know if you can contract tetanus from rust?
From
If it
Russ?
cuts your skin? If rust cuts your skin, like rust gets inside, do you know if you can contract the disease?
Yeah, the bacteria can live on, like, if, like you said, if metal gets rusty after a prolonged period of time, the bacteria can grow, and if you get a deep enough cut from it, then yeah.
He said that it can be transferred from animal to human, it can be transferred from human to human, I don't know if like, relevant.
No, like you can't, if someone with tetanus won't cough and you can't get the disease, it's basically from a wound and the bacteria gets inside of you.
Did you mention any diagnostic techniques for tetanus?
Basically, they just review the symptoms, and if they test your blood